As scary as it might be to talk about, monkeypox cases are quickly rising across many countries. With a monkeypox outbreak potentially looming, it's important now more than ever to explain what exactly is monkeypox, the symptoms that come along with it, and how to prevent it from spreading to you and your loved ones. Knowing more about this quickly emerging threat is key to protecting yourself, and there are definitely some precautions that you can take that will help prevent a major monkeypox pandemic. Without further delay, let's define just what monkeypox is, as well as how to protect yourself from it. Number 1. What is monkeypox? Monkeypox is a rare disease that affects humans that have been afflicted by the monkeypox virus. This can result in flu-like symptoms as well as rashes that can break out throughout your body. Infected individuals can also sometimes suffer from muscle aches, headaches, and a lack of energy. When it comes to knowing how monkeypox spreads, the virus is mainly transmitted through physical contact, and it can often take some time for the virus to spread. Monkeypox can also be spread through respiratory droplet particles like saliva, although this is slightly less common. Transmission of monkeypox can also happen when touching the same surface as someone who has the virus, or directly touching a lesion that occurs as a side effect of the disease. Number 2. How to protect yourself from monkeypox. When it comes to reducing the spread of monkeypox, your best bet is to exercise caution. Thankfully, monkeypox is a bit easier to track than the coronavirus was at the beginning, and protecting your skin is going to go a long way. The CDC recommends that people exercise extreme caution when they head to places where they will be forced to be in close personal contact with strangers, such as clubs and public transport. In areas where a lot of skin is being exposed, you should be extra careful, as this is an easy way for the virus to get passed on to you. The CDC also urges you to keep bedding, towels, and clothes worn by someone known to have monkeypox away from you, only touching them while wearing some kind of protection for your skin. Number 3. Is there a vaccine? Although monkeypox was first detected in the U.S. in 1958, before today, outbreaks in the U.S. have been sporadic at best. A monkeypox vaccine is still probably a few months away at this stage, so it seems doubtful that we will be able to rest easily. Still though, the CDC is saying that an outbreak in the U.S. is unlikely right now, and is closely monitoring the situation just to be sure. An outbreak of monkeypox in the U.S. seems like it is far off even in the bleakest of projections, but there are still vaccines that should be able to help. Smallpox is somewhat closely tied to monkeypox, and early data shows that there is an 85% effectiveness of that vaccine helping to fight off monkeypox, as the two diseases share some key similarities. The world successfully banded together to rid itself of smallpox a few decades ago, and so early signs are promising that monkeypox can be halted in a similar way. Number 4. What to do if you have symptoms. Monkeypox symptoms are pretty easy to spot, as they primarily appear as a sort of skin rash that is easy to identify. If you do feel like you could be experiencing this rare disease though, you should isolate yourself immediately. Just like with COVID, it's important to limit your physical contact with other people, and so you should alert anyone you are living with and have them wipe down any surfaces you frequently occupy with alcohol and other cleaning products. The World Health Organization recommends that you should also spend about 3 weeks from first exposure in isolation, to limit your chance of passing it on to others. From there, it becomes about helping your skin out, and so try bathing in salt water if you have lesions. Keep your skin dry and uncovered, and clean the skin often with sanitizing wipes or hand sanitizer. Number 5. How deadly is it? Visible damage to the body is always going to shake people up, and the rashes definitely have done a good job of frightening people about how serious monkeypox can be. Despite this, the CDC estimates that over 99% of people can survive a bout of monkeypox, and that they should not have much to worry about in terms of mortality risk. Much like smallpox all those years ago, monkeypox and the infection that it causes is most harmful to children under the age of 8, so children should especially be careful to not catch monkeypox. Scarring from the rashes can occur as well, and in extreme cases a loss of vision too, but instances of this are pretty rare. Have any tips to protect yourself from monkeypox? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.